Hello friends, welcome to my channel Medical Lectures. Today we will study androgen insensitivity syndrome. It is an important topic of OBGY, so let's discuss this. So what is androgen insensitivity syndrome? It is also known as Morris syndrome or testicular feminization syndrome. It is an X-linked recessive syndrome due to mutation in X chromosome and peculiarly due to mutation in X chromosome, and that is long arm of X chromosome, that affects the androgen receptor gene. That so in this syndrome there is no androgen receptor gene, and when there is no androgen receptor gene there will be no androgen receptor produced, and androgen receptors helps to bind with the androgen and helps in the development of secondary sexual characters. So the karyotype of androgen insensitivity syndrome is 46XY, that is male genetic sex, but his development and physical appearance is female, that is it is also known as male pseudo hermaphroditism. So what are the features of androgen insensitivity syndrome? They have normal breast, absent pubic hair, blind vagina, absent uterus, and testis is present in the form of undescended testes. So there is uterine fallopian tube agenesis. There will be no ovary. So it can lead to primary amenorrhea and infertility. So how will manage this condition? The management is gonadectomy, replacement therapy, and vaginoplasty.